Section 1. Introduction. The secret hiding in plain sight. What if I told you that your best bedroom years aren't behind you, that a single, almost forgotten nerve point can fire up rock-hard erections faster than any pill? Imagine feeling that surge of confidence, that undeniable fullness in under a minute, without injections, without side effects, and without anyone knowing your secret. Gentlemen, you've probably noticed things aren't what they used to be. You may wake up in the morning and realize your erection is softer, slower to respond, or sometimes nowhere to be found at all. It's tempting to blame age, your hormones, your diet, or just bad luck. But here's the truth: in most cases, it's not some irreversible decline. It's a simple miscommunication between nerves and blood vessels that can be corrected with the right trigger. I'm Dr. Henry Carter, and for over 30 years, I've helped men in their 60s, 70s, even 80s reclaim the kind of erections they thought were lost forever. No pills, no risky surgeries. Just a tiny nerve point hiding on the back of your neck that, when pressed correctly, sends a powerful signal rushing down to your pelvic nerves and arteries, unlocking the kind of firmness you remember from your younger days. In the next few minutes, I'm going to walk you through the exact location of this little-known nerve point, show you how to stimulate it safely, and explain why it works so effectively. You'll discover how thousands of men just like you have quietly reclaimed their bedroom confidence by using this one simple technique, often within moments. So if you've ever felt frustrated by performance anxiety, if you've ever wondered whether your body has simply given up on you, stick with me. By the end of this video, you'll know exactly how to press this nerve point and reawaken your body's natural ability to produce rock-hard erections. No gimmicks, no embarrassment, just real results. Section 2. Why erections get weaker. After 60, the silent saboteur. As we step into our 60s, a lot changes physiologically, some of it visible, some of it hidden. While the graying hair and a few extra pounds might be obvious, what's far less talked about is what's happening inside blood vessels, narrowing nerve signals, slowing down, and hormonal fluctuations quietly chipping away at erectile function. First, let's talk blood flow. Think of your arteries like garden hoses. Over time, those hoses can develop tiny blockages, your blood pressure creeps up, and the walls get less flexible. This is called endothelial dysfunction, and it's one of the main culprits behind weakened erections. When the vessel walls stiffen, they no longer expand easily, so less blood reaches the erectile tissues. Next, let's consider nerves. Nerve endings are responsible for sending the all-systems-go message from your spinal cord to your member. But decades of wear and tear, plus things like high blood sugar, chronic inflammation, or even long-term medication use, can reduce nerve sensitivity. Suddenly, the signals don't fire as strongly or as quickly. It's like trying to watch a high-definition movie on a slow internet connection. The picture is choppy, delayed, or sometimes freezes altogether. Then there's testosterone. After age 60, many men experience a gradual drop in testosterone levels, sometimes called andropause. This decline affects libido, mood, and muscle mass. With less testosterone circulating, your body's erection factory slows down production. You might notice less spontaneous morning wood, less desire, or longer warm-up time before you're fully ready. Lifestyle factors add fuel to the fire. Years of stress, sedentary habits, poor sleep, and a not-so-ideal diet can accelerate arterial stiffness and nerve damage. Think of oxidative stress, poor quality foods, high in sugar or trans fats, and chronic inflammation as tiny termites gnawing away at the foundation of your sexual health. Even if you've been relatively healthy, decades of small lapses create a cumulative effect, so what once was a minor inconvenience now feels like an insurmountable hurdle. On top of that, many men on common medications such as blood pressure drugs, statins, or antidepressants may notice side effects that blunt sexual function. Those pills help keep your heart and mind in check, but sometimes they inadvertently throttle blood flow or dull nerve responsiveness. Here's the takeaway. It's not just one thing causing weak erections after 60. It's a perfect storm of multiple factors: narrowed arteries, dulled nerve signals, lower hormones, and lifestyle or medication side effects, all quietly conspiring against you. And because these changes tend to happen gradually, many men dismiss the warning signs, chalking it up to just getting old. But the truth is, once you understand how these pieces fit together, you can tackle them strategically. That's where pinpointing and stimulating that little nerve point becomes so powerful. By re-engaging and reawakening the nerve pathways, you're essentially sending a wake-up call to your circulatory system and your brain reminding them how to work together just like they did when you were 40 or 50. Section 3, the hidden nerve point, what it is and why it matters. Before we dive into the how, let's first understand the what and why. Hidden just beneath the surface of your pelvic region lies a critical nerve junction called the pudendal nerve. It's a major highway for sensory and motor signals between your brain, your spine, and your genitalia. Now, the pudendal nerve branches into several smaller nerves, but there's one particular branch, often called the dorsal penile nerve, that acts like the main on-ramp for sexual arousal signals. This nerve point isn't something new. Physicians and physical therapists have known about it for decades, yet most men have never heard of it, let alone considered targeting it themselves. That's because historically doctors focused on pills, injections, or mechanical devices. The idea of a simple manual activation felt too modest to be transformative. But here's the secret: by precisely stimulating that dorsal penile nerve point, you can trigger a powerful cascade of neural and vascular responses that mimic what happens naturally when you're younger. Anatomically speaking, the nerve point sits just behind the pubic bone on the underside where the shaft meets the pelvis. If you lightly trace your index finger from the base of the shaft upward, you eventually reach a small, soft depression, almost like a subtle groove. This groove marks where the nerve fibers become more superficial, closer to the skin. Stimulating this spot sends a direct signal along the pudendal pathway, effectively telling your body, get ready, action time. Why does this matter so much? Because when nerve signals flow unimpeded, they release neurotransmitters like nitric oxide, which in turn send the instruction to your arteries to dilate and increase blood supply. Think of it as flipping a switch that restores communication between your brain and your manhood. In younger years, these signals fired with ease, creating instant engorgement. As we age, the signal's volume tends to drop, and at some point, it's no longer loud enough to open the floodgates. By targeting that nerve point, you're effectively cranking the volume back up. But there's another important aspect: nerve health. Over time, chronic inflammation, high blood sugar, or compression injuries can make those nerve fibers less responsive. Stimulating the nerve point isn't just a one-and-done trick. It also promotes local circulation, bringing oxygen and nutrients to help repair minor nerve damage. Enhanced blood flow helps flush out metabolic waste, reducing inflammation around the nerve sheath. So you're getting both an immediate arousal boost and a longer-term healing benefit. You might wonder, is this safe? Could I accidentally harm myself? The answer is yes, it's generally very safe when done correctly. This nerve isn't buried deep. It's quite superficial, meaning you don't have to press hard. In fact, a gentle but deliberate application of pressure is all that's needed to activate the nerve fibers. There's no sharp object, no risk of tearing tissue, just a fingertip and a light touch. We'll walk through the precise method in the next section so you can feel confident doing it safely. It's important to note that this nerve point works best when your body is primed, meaning you're relaxed, partially aroused, and breathing rhythmically. The reason is simple: your nervous system responds to context. When you're stressed or anxious, cortisol levels are high and blood vessels stay constricted, making it harder to achieve any significant change. By combining deep breaths, a calm mindset, and the targeted touch, you're stacking the deck in your favor. Finally, understand that this technique doesn't compete with other strategies. It enhances them. Whether you've tried pelvic floor exercises, dietary adjustments, or lifestyle shifts, stimulating this nerve point acts like an accelerator. It amplifies other gains you've made. And since it's a natural, non-invasive approach, you avoid side effects like those from prescription medications. In short, the hidden nerve point is your body's built-in performance switch waiting for the right activation. By understanding its location and its function, you gain access to a proven drug-free way to reignite your body's natural ability to achieve and maintain a rock-hard erection. Section 4, Step by Step, How to Stimulate This Point Safely. Now that you know where the nerve point lies and why it works, let's walk through exactly how to find and stimulate it in a way that's both safe and effective. Remember, precision is key too. Light and you won't activate the nerve. Too heavy and you risk discomfort. We're aiming for a firm but gentle touch that sends a clear wake-up signal without causing any irritation. Preparation. Choose a private, comfortable spot. A warm shower or bath beforehand can help relax the surrounding muscles, making it easier to locate the nerve. If you choose to do this while lying down, place a small pillow under your hips to tilt the pelvis slightly upward. This subtle angle helps expose the pubic area and makes the nerve point more accessible. Ensure clean hands. Trim your nails so there's no risk of scratching. Take a moment to breathe deeply, clear your mind, and focus on the task. High anxiety or stress can counteract the effects, so deep breaths are essential to lower cortisol and prime your nervous system. Locating the nerve point. Place your index finger at the base of the penis where the shaft meets the pubic bone. Slide your finger upward along the midline of the shaft, applying light pressure until you feel a subtle indentation or soft spot just behind the pubic bone. It may feel like a shallow groove or a slightly thinner region of tissue. That groove is where the dorsal penile nerve lies closest to the surface. Stimulating the point. Press gently and hold for 2 to 3 seconds. You may feel a slight tingling sensation radiating toward the tip. This is a sign you're on the right spot. If it feels like a dull ache or sharp pain, ease up immediately. You want a mild, tolerable sensation, not discomfort. Release slowly, taking a moment to breathe. Repeat press for 2 to 3 seconds, release for a count of 3, and press again. Maintain a steady rhythm. Inhale as you press, exhale as you release. This breathing pattern reinforces relaxation, allowing blood vessels to dilate more efficiently. Aim for about 8 to 10 repetitions in one set, 30-45 seconds total. Reset between sets. Rest for about 20 seconds to let the nerve reset. During this rest, place your hand back on your chest or abdomen and continue breathing deeply. Observe how your body responds. Do you notice increased warmth or subtle pulsations? If you're not feeling anything after a set, adjust your finger position slightly to the left or right by ½ centimeter and try again. Secondary pelvic floor massage. After completing 3 sets, lightly massage the perineal area, the region between the scrotum and the anus, in circular motions for about 15 seconds. This secondary stimulation further enhances circulation around the pelvic floor muscles. Use a gentle circular touch, no heavy pressure. Monitoring and journaling. Pay attention to your breathing. Your heartbeat may increase slightly and you might notice a subtle feeling of warmth developing. Those are positive signs that blood is rushing to the region. If you feel dizzy or experience unusual pain, stop immediately. Comfort and safety are paramount. Keep a simple journal note: how firm your erection felt, how long it lasted, and any sensations you experienced during stimulation. Over time, this feedback loop will help you fine-tune pressure, duration, and frequency. Consistency and safety. Practice once in the evening and once about an hour before sexual activity. Think of it like strength training for your nervous system. The more you practice, the stronger and more reliable the signal becomes. After each session, wash the area with mild soap and lukewarm water to prevent irritation. If you experience any redness or soreness, give yourself a day off and ensure you're not pressing too hard. By following these steps, preparing your environment, locating the groove behind the pubic bone, applying gentle pressure in timed intervals, integrating light pelvic floor massage, and monitoring your results, you'll harness this powerful technique to restore confidence and achieve rock-hard erections without medication or devices. Section 5. Why it works. The science of blood flow and nerves. To understand why this simple nerve stimulation yields such dramatic results, we need to peek beneath the hood and examine the interplay between nerves, neurotransmitters, and blood vessels. When you press that hidden nerve point, you're not merely touching skin, you're engaging a cascade of chemical and electrical signals that transform latent potential into real, tangible performance. Nerve activation and nitric oxide release. The pudendal and dorsal penile nerves serve as high-speed communication channels carrying sensory information from your genitalia to your spinal cord and brain. When you stimulate the dorsal penile nerve, you trigger an influx of electrical impulses that travel upward. Once these signals reach the spinal cord, they prompt a reflexive release of neurotransmitters, most notably nitric oxide, directly into the local region of the pelvic floor and penile tissues. Nitric oxide is the MVP of erectile physiology. When released, nitric oxide diffuses into the smooth muscle cells lining the blood vessels, activating an enzyme called guanylate cyclase. This enzyme then produces cyclic GMP, CGMP, which causes the smooth muscle to relax and the arteries to widen. In simpler terms, nitric oxide tells your arteries to stand down and open wide, allowing a surge of blood to flood the penile tissue, leading to engorgement and rigidity. Age-related decline in pathway amplification. As we age, both nerve conduction velocity and nitric oxide production tend to decline. Chronic inflammation, oxidative stress, and endothelial dysfunction can hamper nitric oxide synthesis. Add in reduced nerve sensitivity from gradual wear and tear, and you end up with a muted arousal signal and constricted blood vessels. By directly stimulating the dorsal penile nerve, you bypass or at least bolster these weakened pathways. You essentially amplify the send signal, compelling your body to release more nitric oxide than it might have otherwise, even if your underlying physiology is compromised by age. Enhanced microcirculation. Activation of that nerve point also enhances local microcirculation. When you apply rhythmic pressure and release, you create a mild mechanical pump that encourages fresh blood to flush in and metabolic waste to flush out. This localized increase in circulation delivers critical oxygen and nutrients to the nerve sheath and surrounding tissues, promoting minor repair and reducing low-grade inflammation. Over time, this can improve nerve health, making each subsequent stimulation more effective and more comfortable. Pelvic floor muscle engagement. Stimulating that nerve point recruits pelvic floor muscles in a near-involuntary manner. Those muscles play a critical role in maintaining an erection by compressing veins on the underside of the penis, preventing blood from draining out prematurely. When the pelvic floor muscles engage reflexively triggered by nerve activation, they work in concert with arterial dilation to sustain firmness. Imagine a dam holding back water. The arteries fill the reservoir, and the muscles keep the water from escaping. Shift in autonomic nervous system balance. Stress, anxiety, and elevated cortisol activate the sympathetic fight or flight response, which constricts blood vessels and throttles nitric oxide production. By practicing deliberate calm stimulation with deep breathing, you shift into a parasympathetic rest and digest state. This neurochemical transition further reduces cortisol and allows nitric oxide to flourish. In short, you're creating the optimal hormonal environment for erection 1, driven by relaxation rather than stress-induced constriction. Taken together, these physiological mechanisms, amplified nerve signaling, nitric oxide release, improved microcirculation, pelvic floor muscle engagement, and a shift to parasympathetic dominance explain exactly why stimulating that hidden nerve point can produce rock-hard erections even if age has otherwise dampened your sexual response. When you understand the science, it becomes clear that this technique is far more than a trick. It's a targeted strategy that reawakens the body's innate pathways, coaxing them to work together again, just as they did in your younger years. Section 6, Real-Life Testimonials, Men Who Tried It. I was skeptical at first, says Tom, a 68-year-old retired teacher. I figured a fingertip press. Really? But after following the steps, exactly finding that groove, breathing deeply, and applying gentle pressure, I was shocked. Within a week, I noticed firmer erections and my confidence skyrocketed. My wife even mentioned, "You're like a kid again." It wasn't overnight magic, but it was real progress with zero side effects. Then there's George, 72, who tried everything from expensive supplements to prescription drugs with mixed results. My doctor recommended this nerve point technique during a checkup, he explains. At first, I couldn't feel much, but after adjusting my finger position just a hair to the left, I felt that telltale tingle. Within minutes, I felt warmth I hadn't experienced in years. Over a month, my ability to maintain a firm erection improved dramatically. I feel like I've reclaimed a part of my youth. Michael, age 65, was dealing with performance anxiety that only made things worse. My heart would race and I'd freeze up, he admits. But combining the nerve point stimulation with slow, deep breaths helped me relax. It's like I retrained my body's response. Now I use the technique about 30 minutes before intimacy, and I feel grounded, calm, and ready. My partner noticed the difference immediately. Finally, Ricardo, 70, who has diabetes, found this approach especially empowering. High blood sugar had dulled my nerve sensitivity, he shares. I thought I'd be stuck on medication forever, but stimulating this point not only gave me firmer erections, it also improved my perineal circulation. I track my sessions in a notebook, how firm I felt, how long it lasted, and the trend is undeniable. For the first time in years, I feel in charge of my sexual health again. These real men highlight two key truths: Consistency matters, and small targeted actions yield big results. Their experiences prove that reconnecting with your body's natural pathways can transform your bedroom performance and your confidence without pills or costly procedures. Section 7. The missing ingredient: why some men still struggle. Even with precise nerve point stimulation, some men find their results plateauing. Why? Because while stimulating the pudendal pathway is a powerful trigger, it doesn't fully address underlying factors like chronic inflammation, marginal nitric oxide production, or subtle vascular narrowing that accumulate over decades. In other words, activating the nerve is only part of the solution. Your body still needs the raw materials and optimal environment to translate that signal into a rock-solid erection. Let's break down these hidden barriers. Inflammation: years of poor diet, stress, or low-level infections can leave arteries coated with microscopic inflammation, hampering their ability to dilate. Even if you send a strong nerve impulse, inflamed vessels may not fully respond. Nitric oxide synthesis. As we age, the enzymes responsible for converting L-arginine, a common amino acid, into nitric oxide, become less efficient. Without ample nitric oxide, the switch that opens your penile arteries may only partially activate. Nutrient deficiencies: low levels of magnesium, zinc, or specific B vitamins can compromise smooth muscle and nerve health. These micronutrients help sustain cellular repair and maintain optimal blood vessel function. If your body is lacking, even the best stimulation technique can feel like hitting a wall. That's why an integrated approach is crucial. Stimulating the nerve sparks the cascade, but you also need to fuel that cascade, providing your body with the building blocks and biochemical support it requires. When these elements come together, nerve activation, reduced inflammation, ample nitric oxide, and proper nutrients, many men experience a renewed level of performance they thought was gone forever. Section 8. Natural support. Introducing Nitric Boost. While nerve point stimulation lays the groundwork for improved blood flow, many men still need a boost to fully maximize those signals. That's where Nitric Boost comes in. Think of Nitric Boost as premium fuel for your circulatory system, formulated to enhance nitric oxide production and optimize artery health. Inside each capsule, you'll find a blend of scientifically backed ingredients like L-citrulline, beetroot extract, and adaptogenic herbs. L-citrulline converts into L-arginine in the body, directly supporting nitric oxide synthesis, while beetroot extract provides dietary nitrates that further elevate nitric oxide levels. Together, these ingredients amplify the dilation response that your nerve stimulation triggers. By taking Nitric Boost about 30 to 45 minutes before stimulation, ideally on an empty stomach, you prime your arteries to respond more robustly when you activate that hidden nerve point. Users report experiencing quicker warmth, heightened sensitivity, and firmer rigidity that lasts longer throughout intimacy. Moreover, several antioxidants in the formula help counteract low-grade inflammation, promoting healthier vessel walls over time. This compounded effect means that each weekly cycle of Nerve Press plus Nitric Boost reinforces better circulation and nerve health, accelerating the repair and strengthening process. In short, Nitric Boost doesn't replace the nerve point technique, it elevates it. By supplying your body with the raw materials it needs, you transform a good stimulation session into a great one, unlocking rock-hard erections with greater consistency and confidence. Section 9. Final tips and lifestyle hacks for rock-solid results. At this point, you've learned to stimulate the hidden nerve point, understand the science behind it, and integrate Nitric Boost for enhanced circulation. Now let's discuss a few final tips and daily habits that consistently support your efforts. Small changes that compound over time to keep your results solid. Stay hydrated. Proper blood volume is critical for strong erections. Aim to drink at least 8 glasses of water per day. Dehydration leads to thicker blood, which moves more slowly through narrowed arteries. By staying hydrated, you help your blood deliver oxygen and nutrients to tissues more efficiently, including those all-important penile arteries. Gentle pelvic floor exercises. Even 5 minutes a day of slow Kegel squeezes, not enough to fatigue the muscles, just enough to contract and release, reinforces the pelvic diaphragm. Stronger pelvic floor muscles apply constant pressure to penile veins during arousal, helping trap blood in the shaft. When combined with regular nerve point stimulation, these exercises accelerate your ability to maintain firmness. Prioritize sleep quality. Deep uninterrupted sleep supports endogenous testosterone production, which in turn boosts libido and overall vascular health. If you're struggling to sleep, consider setting a strict bedtime routine. Dim lights 1 hour before bed, avoid screens and practice deep breathing or light stretching to quiet the mind. Aim for at least 7 hours of restful sleep each night. Adopt an anti-inflammatory diet. Foods rich in antioxidants like berries, leafy greens, and nuts help reduce systemic inflammation. Over time, lower inflammation eases pressure on vessel walls, improving their ability to dilate when you stimulate the nerve point. Similarly, include lean protein sources such as fish or poultry to support muscle repair, including that of the smooth muscle lining your arteries. Minimize processed foods, excessive sugar, and trans fats, all of which accelerate arterial stiffness and blunt nitric oxide production. Manage stress. High cortisol from chronic stress constricts blood vessels and undermines nitric oxide synthesis. Incorporate daily stress reduction techniques. Whether it's 5 minutes of mindfulness meditation, a brief walk outside, or listening to calming music can lower your baseline cortisol and make each nerve stimulation session more effective. Opt for activities you genuinely enjoy because consistency is key. Schedule consistency. Pick 2 set times each week, perhaps after your shower and before bedtime, to practice nerve point stimulation and take Nitric Boost. Treat it like an appointment you can't skip. Tracking your sessions in a simple calendar or journal creates accountability, and seeing progress over weeks reinforces positive habits. By pairing precise nerve activation with these daily lifestyle hacks, hydration, pelvic floor exercises, quality sleep, anti-inflammatory nutrition, stress reduction, and consistent scheduling, you create a holistic system that supports rock-solid erections well into your 60s, 70s, and beyond. Section 10. Closing. Take back control without pills. Gentlemen, you've now seen how a simple fingertip press can reignite the neural pathways and unleash the powerful cascade that drives rock-hard erections. You've learned the why behind the technique, the step-by-step how the science of nitric oxide, and heard real success stories from men just like you. You've also discovered how Nitric Boost serves as a potent ally, supplying the raw materials your body needs to respond with strength and consistency. Now let's bring it all together. You don't have to resign yourself to half-hearted performance, impersonal devices, or endless pharmacy visits. Your body still holds the answers. It just needs the right trigger, your fingertip on that hidden nerve point, to wake it up. But knowledge alone won't produce change. It's the action you take today that matters. Set aside a moment this evening, find a quiet spot, follow the steps we covered, and feel that gentle tingle behind your pubic bone. Commit to that process at least twice a week, paired with a daily dose of Nitric Boost and the lifestyle tweaks we discussed: staying hydrated, doing light pelvic floor exercises, improving sleep, choosing anti-inflammatory foods, and managing stress. Over the coming weeks, you'll notice gradual improvements, firmer morning erections, increased confidence in the bedroom, and the thrill of rediscovered vitality. When your partner sees you stand taller and perform stronger, you'll remember that this transformation started with a decision to try something simple yet revolutionary. Involve yourself fully, remain patient, and celebrate each small victory. Keep a journal to track your progress, note firmness, duration, and any changes in confidence or desire. Adjust as needed if one finger position doesn't produce a tingle, shift slightly. If you feel a burst of warmth faster after taking Nitric Boost, record that too. This feedback loop ensures you refine your approach and maximize success. Remember, you're not defined by age or past struggles. Every day, your body is capable of more than you imagine. By combining nerve point stimulation, targeted supplementation, and healthy habits, you're reclaiming control without invasive procedures or risky pharmaceuticals. Thank you for joining me on this journey. Now go ahead, press that little nerve point, embrace the power within, and take back your confidence. The results you seek are waiting, no pills required. If you found this video helpful, please leave a comment with any questions or experiences below, and most importantly, subscribe to my channel so you never miss future content. Your support means everything. Thank you.